just let me know. All right, class, so welcome to Tuesday. I'm just going to go through the most recent announcement that I posted from yesterday. I believe I did it. So this is the first part of November. We just have a couple months of class left. You have 2 assignments due by Sunday, a Labster lab on diabetes, and then an open note, open book quiz on chapters 15 and 16. We'll get through chapter 15 tonight, and then chapter 16 will be on blood. We'll try to all get through on Thursday, or I might, if we need to have a part 2, I'll post another recorded part 2 by Friday. So those are your assignments due this week. So have fun with that Labster lab on diabetes. And then this is a part 2 to the chapter 15. We're going to finish up our endocrinology discussion, kind of continuing with the different glands in the body and what hormones they produce. So again, for this chapter, you should focus on the glands of the endocrine system, where they're located, the general hormones that come from each of the glands, and then what those hormones do. And just really simply put, a way to study would be, thyroid gland, thyroid hormones, what do they do? Or the gonads, what do? They produce testosterone, estrogen. So understanding kind of the general glands of the endocrine system, the hormones they produce, and then what they do will help you prepare for this chapter, as well as going to the hormone workshop if you guys can get to that workshop. So the thyroid gland is located around, kind of right below your larynx, right below the thyroid cartilage around your voice box. And it produces it has parafollicular cells that secrete calcitonin, which decreases blood calcium levels, and we'll go through that. The follicular cells are what will secrete your thyroid hormones that we're going through now. And the 2 major thyroid hormones are T4 and T3. The thyroid hormones are your body's major metabolic hormones. So your thyroid hormones have to do with all metabolic functions. And you'll notice in this PowerPoint, I highlight some things to help you guys out a little bit too. But your thyroid hormones handle all of your metabolic functions. So you have T4 and T3. Basically, T3 is the inactive form. T4 is active. So T3 always has to be converted to T4 to be activated. And that T4 is what will be activated, which will go on and control metabolic functions of a lot of the tissues and cells. Both of these require iodine to be converted or to be active. So years ago, they started adding iodine to salt. So you'll see iodized salt in the grocery store for the iodine to help make these thyroid hormones active. Thyroid hormone affects virtually every cell in the body. It enters the target cell, binds to intracellular receptors. It triggers transcription of various metabolic genes. It increases the metabolic rate and heat production, and this is referred to as the calorogenic effect. So again, what that just means is your thyroid hormones are regulating all metabolic functions. So the ability that you turn glucose, for what you eat, into energy. Your thyroid hormones regulate tissue growth and development, which is critical for normal skeleton and nervous system. Your thyroid hormones help to maintain blood pressure. So this is a look at regulation of thyroid hormone secretion, kind of this flowchart idea that we covered a little bit last week. Your hypothalamus secretes a releasing hormone called thyrotropin releasing hormone, which acts on your anterior pituitary to release thyroid stimulating hormone. That's what acts on your thyroid gland to release the thyroid hormones that control the metabolic functions of the body. So this is kind of the major effects of thyroid hormone. You don't need to know all of them. The biggest one you need to know is that the thyroid hormones are basically controlling all metabolic functions. So carbohydrate, lipid, and protein metabolism. So the ability of breaking down your foodstuffs and turning it into energy. But it also has an effect on the nervous system, cardiovascular system, muscular, skeletal, GI tract, reproductive system, and integumentary system. So if you have problems or imbalances with the thyroid hormone, it can really mess up all of your body's systems. And a lot of these imbalances often occur in women. If you have a hyposecretion of thyroid hormone, this can lead to mixed edema, which symptoms include a low metabolic rate, thick or dry skin, puffy eyes, feeling chilled, constipated, edema, which is swelling, mental sluggishness, and lethargy. So this is hyposecretion or hypothyroidism. So not enough thyroid hormones. So if you don't have enough thyroid hormones to kind of kick your metabolism into gear, everything's going to slow down. So these symptoms all have to do with kind of a slowing down of your body's systems. A goiter may develop if due to a lack of iodine where the thyroid could enlarge. This goes through a little bit about congenital hypothyroidism, if this happens in early childhood or the growth and brain development. I won't ask you guys really questions about this, but it can affect babies sometimes if it's a pituitary problem or some sort of medication from the mom. So this is a look at a goiter, an enlarged thyroid due to iodine deficiency. So you can kind of see that in the neck. So the enlarged thyroid kind of pushes out, almost looking like a tumor, but it's called a goiter, and it's just from an enlarged thyroid. So here we have our first highlighted word. If you have hypersecretion of thyroid hormone, so too much thyroid hormone circulating in the body, it can lead to autoimmune disease called Graves' disease. So if you are hyperthyroid, you have too many thyroid hormones. So all of your body systems are like kicked into gear on overdrive. So you have an elevated metabolic rate. So people lose weight rapidly, sweating, increased heat, rapid and irregular heartbeats, heart palpitations, nervousness. So this eventually hyperthyroidism can lead to this Graves' disease, or it can just be Graves' disease because it's an autoimmune disease where the body will make abnormal antibodies directed against the thyroid follicular cells. Treatments can include surgical removal of the thyroid. So if you have too much thyroid hormones, you can just take your thyroid out, and those people can take synthetic thyroid hormones for the rest of their life, or a type of radioactive iodine. So remember, your thyroid hormones, you need iodine to function. They're the only cells in your body that need iodine. So if you give your body a radioactive iodine form, radioactive is bad, and that'll just destroy the active thyroid cells. Here is bulging eyes, exophthalmos, which is a common sign of Graves' disease as well. Calcitonin is produced by parafollicular cells in the thyroid. They're the antagonist to parathyroid hormone. So parathyroid hormone will increase blood calcium levels, and calcitonin tones down blood calcium levels. So it decreases blood calcium in the blood. It'll take calcium in from the blood and store it into your skeleton. So that's calcitonin secreted by the parafollicular cells. Parathyroid gland are 4 to 8 little tiny yellow-brown glands that are embedded into the posterior aspect of the thyroid. Parathyroid hormone is the most important hormone in calcium levels in the blood, and parathyroid hormone will increase blood calcium levels. So it's secreted in response to low blood calcium levels, so it will increase it. What it does is it targets the organs of your skeleton, kidneys, and intestines to try to tell your skeleton, kidneys, and intestines to preserve calcium and put it back into the blood. So here are the little tiny pea-sized structures on the back of the thyroid gland, the parathyroid gland. This is how it works. You don't really need to know that. It just stimulates osteoclasts to digest bone matrix to put calcium into the blood, and then enhances the reabsorption of calcium by the kidneys. It also enhances activation of vitamin D by the kidneys, which also leads to increased absorption of calcium in your intestines. So that's parathyroid hormone, the most important hormone in maintaining your blood calcium levels. And then the adrenal gland is interesting. It sits on top of the kidneys. It has kind of 2 layers to it, the adrenal cortex and the adrenal medulla, and they both secrete different hormones. The one thing you should know is the adrenal medulla is a part of your sympathetic nervous system because it secretes your adrenaline hormones, the norepinephrine and epinephrine, which get your body ready for the fight and flight response. The adrenal cortex secretes over 24 different hormones called corticosteroids. There's 3 different labels of the cortical cells that produce these different corticosteroids. I don't think I asked you guys specific questions on the layers and what corticosteroid they produce, But just looking at this picture here, the cortex is the outer, the more superficial layer of the adrenal gland, and the adrenal medulla is kind of the deeper inner layer. A couple things about the adrenal cortex, the mineralocorticoids, one of them that it does secrete that I want you to know is aldosterone. It's the most potent mineralocorticoid, and this will stimulate sodium reabsorption by the kidneys. So aldosterone will be secreted if there's a drop in blood volume or blood pressure, because aldosterone will tell your kidneys to retain or reabsorb sodium and retain water. So that will result in an increased blood volume and blood pressure. So you should know that too. Other mineralocorticoids are shown here. We have a renin-angiotensin aldosterone mechanism that helps to increase blood pressure and blood volume in the body. This renin-angiotensin aldosterone system, and I think we talked about this, I get my classes confused. I think we might have mentioned this last week. The decreased in blood pressure tells your kidneys to release renin. Renin goes through a series of steps that basically creates angiotensin 2, which also stimulates aldosterone release and tries to constrict your blood vessels. So you don't need to know too much about that. Other mineralocorticoids are shown here. Plasma concentration of potassium, ACTH, and an atrial natriuretic peptide. We'll talk about this at the end, but this is one of the hormones that's actually secreted by an organ that's not in the endocrine system. It's secreted by the heart in response to high blood pressure. It will block renin and aldosterone to try to decrease your blood pressure. So that's atrial natriuretic peptide. So here are some major mechanisms controlling aldosterone release. You don't need to know all the major mechanisms, but you should know that aldosterone is released from the adrenal cortex to retain sodium to increase blood pressure. Aldosteronism is hypersecretion, usually due to a tumor in the adrenal gland. So it will result in hypertension because it's, and swelling or edema because it's retaining too much sodium. That one you don't need to know. More glucocorticoids influence the metabolism as well, help us resist stressors. I'm going to kind of skip over these. I don't think I asked you too many about these. The actions of cortisol causes an increase in blood levels of glucose, fatty acids, and amino acids. It gets your body also ready to use up kind of stored energy sources. Okay, so I'm going to kind of skip over these as well. I want to talk a little bit about Cushing syndrome. You might see this in the future in any of your health careers. I don't have this one highlighted. I've highlighted other diseases I want you to know. If you have a hypersecretion, you'll get Cushing syndrome or Cushing's disease, which depresses cartilage and bone formation and the immune system. So it causes from it could be a tumor on the pituitary. A Cushing-oid sign is a moon face or a buffalo hump. And the treatment is the removal of the tumor wherever it is. So that's Cushing syndrome. Addison's disease can be hyposecretion, and this usually involves any sort of deficit in both a glucocorticoid and a mineralocorticoid. So we're looking at a deficit in one of these corticoids, either the glucocorticoids or mineralocorticoids that are coming from the adrenal cortex region of the adrenal gland. So hyposecretion means there's too little of them. There can be a decrease in plasma glucose sodium levels. It can cause weight loss to severe dehydration, and hypotension are common. And an early sign of Addison disease is actually a bronzing of the skin due to high levels of the ACTH, which triggers melanin production in the melanocytes. So the bronzing of the skin is characteristic of Addison's disease. This is a look at Cushing syndrome. So you can kind of see this hump that develops on the back. And, again, I don't ask you specifics about Cushing's. I do ask you a specific about Addison's. But, just knowing kind of in general, Cushing syndrome has something to do, with the adrenal medulla. It's just, if you ever run across that and you see a hump on a patient's back, remember, they wonder if they have Cushing syndrome, and then you can look that up as well. Gonadocorticoids, these are adrenal sex hormones that can contribute to puberty, sex drive, source of estrogens. Again, I don't ask you too much about that, but the adrenal medulla, then this is the innermost part of the adrenal gland. All that I want you to know about that is this is your part of your sympathetic nervous system, and it creates what we call catecholamines, which are the epinephrine and the norepinephrine, which again are the adrenaline hormones. They get your body ready for the fight or flight response. So these symptoms, vasoconstriction, increased heart rate, blood glucose levels, blood being diverted to the brain, heart, and skeletal muscle that needs it during a stressful situation, are coming from the adrenal medulla, because the sympathetic nervous system is your fight or flight response. Both hormones basically have the same effects. They're a little bit different. The responses to these stressors are brief, unlike the adrenal cortical hormones, which will last a little bit longer. So this is a look at stress in the adrenal gland, how your sympathetic nervous system kind of tells the adrenal medulla of the adrenal gland to secrete these different hormones, which again get your body ready to run away from a wildfire if you're like that man in the picture. So this is kind of the adrenal gland hormones in a basic summary. And again, kind of what I focused on and highlighted are all that you guys need to know about those. And then the last couple of slides, we're kind of coming to the end. This is a shorter PowerPoint. The pineal gland is a very small gland hanging from the roof of your third ventricle, so kind of right behind the thalamus. And it has cells that secrete melatonin, which helps with your day and night cycles. Also, body temperature, sleep, and appetite. So this ability that your body kind of goes in rhythmic variations, that's what melatonin does. It kind of controls your day and night and your sleep and wake cycles. And that's melatonin, which comes from your pineal gland. A picture like that, this will be exactly what's seen, or very similar. You'll have a picture labeling these different glands on your next exam. So just be able to label the different glands for your next exam as well. And then we get to the pancreas, which this is what you'll be covering a lot in your Labster lab, because you'll be talking about diabetes. This pancreas is a triangular gland located partially behind the stomach. If you know of anyone with pancreatic cancer, it's a very fast onset spreading cancer. And once someone has it, it's just hard to treat because it's almost too late. The pancreas is very important for a lot of different functions. It has exocrine and endocrine glands. And the exocrine cells produce an enzyme-rich digestive juices that help with digestion. So these exocrine enzyme-rich juices will go directly to the small intestine via ducts to help with digestion. And then the pancreatic islets, or the islets of Langerhans, will contain your endocrine cells that produce the hormones. And you should know that the alpha cells produce glucagon and the beta cells produce insulin. You should know that. You should know which cells, alpha and beta, produce which. Glucagon is the hyperglycemic hormone. That means that increases blood glucose levels. And insulin is the hypoglycemic hormone. Insulin decreases blood glucose levels. So here are the alpha and beta cells and what they each produce. Alpha produces glucagon, beta cells in the pancreas produce insulin. Glucagon increases blood glucose levels. It's triggered by any sort of decrease in blood glucose levels or the sympathetic nervous system to get glucose readily available in the blood to go to tissues to be converted into energy. It raises blood glucose levels by targeting the liver. So it goes to the liver and tells liver to break down glycogen, which is the storage form of glucose, break it down into glucose, and then it takes it to the blood to try to increase that. Insulin then decreases blood glucose levels, and it's secreted when blood glucose levels increase. So usually after a meal, so after you put a bunch of sugar, glucose, into the blood, insulin is secreted then to lower those blood glucose levels. It enhances membrane transfer of glucose into fat and muscle cells. It inhibits the breakdown of glycogen to glucose because it doesn't need any more glucose in the blood. And it inhibits the conversion of amino acids or fats to glucose. Insulin plays a role in neuronal development. It also triggers cells to catalyze the oxidation of glucose for ATP production. You don't need to know all of this, but insulin has a variety of roles, but the big one is that it decreases blood glucose levels. And you'll go through this a lot more when you specifically look at diabetes in the Labster lab. Some factors that influence insulin release is an elevated blood glucose level. So that's the primary stimulus. If you have too much glucose in your blood, usually after a meal, insulin will be secreted to it takes glucose out of the blood and it will store it in the liver or in other body cells. So here's a look at insulin and glucagon from the pancreas and how they both regulate blood glucose levels. So you'll notice if the increase in blood glucose levels is too high, that first tells the pancreas to secrete insulin, which will stimulate glucose uptake by cells, store it in the liver as glycogen, and the blood glucose levels will fall back to normal range. If blood glucose levels get too low, so if your glucose is too low in the blood, the pancreas will secrete glucagon, which will break down glycogen into glucose to put glucose back into the blood range. So here is diabetes mellitus, and you should know well the type 1 and type 2 and what they mean of diabetes mellitus. It can be due to hyposecretion of insulin. So in type 1 diabetes, the beta cells of the pancreas itself, there's something wrong with them. They cannot secrete adequate insulin. So type 1 diabetics are usually born that way, or it's something that's onset later in life, but it's not I don't want to say it's their fault, but type 1 diabetics, it's no environmental factors. They weren't not exercising, not eating right, they're not obese. Type 1 diabetics, they have to give themselves insulin shots because their cells in their pancreas are not secreting insulin. They have a hyposecretion of insulin. Type 2 diabetes is the hypoactivity of insulin. So what type 2 diabetes is, their bodies are creating insulin, but the cells throughout the body are not reacting to that insulin anymore. And type 2 diabetics, often it's caused by usually inactivity, obesity, poor health, poor intake of nutrients. So type 2 diabetics is due to hypoactivity of insulin. And these are the three cardinal signs of diabetes mellitus, whether it's type 1 or type 2, and you can see that these are highlighted. Polyuria, so poly means too much. So polyuria has a huge urine output. Polydipsia is excessive thirst, and polyphagia is excessive hunger and food consumption because cells cannot take up glucose and are starving. So you should know those three cardinal signs. When sugars cannot be used as fuel in diabetes mellitus, fats are used, which cause lipidemia, which leads to high levels of fatty acids in blood. Fatty acid metabolism can form ketones. Ketones are acidic, and their buildup can be called ketoacidosis, which can lead to ketone bodies in the urine. Untreated ketoacidosis can cause hypernemia, which is disrupted heart activity and oxygen transport, severe depression of the nervous system that can possibly lead to coma or death. So, we hear about diabetes as being kind of the root cause to a lot of different problems. And that's because if left untreated, this is the big thing that happens is these ketones will build up in the urine causing ketonuria, and ketoacidosis in itself, whenever you have an acidosis problem, this could disrupt your heart activity, oxygen transport. It can cause severe depression of the nervous system. So you might notice people with diabetes, they might lose sensation in their feet, or they might get sores on their feet, or lead to coma and death. So if untreated, diabetes can be very scary and very severe. Hyperinsulinism is an excessive insulin secretion. If you have too much insulin secretion, this could cause hypoglycemia, which is low blood glucose levels. So if someone is a diabetic and they're not eating enough, and then they give themselves an insulin shot, the symptoms could be anxiety, nervousness, disorientation, unconsciousness, or even death. And the treatment is sugar ingestion. So these are the consequences of insulin deficient, diabetes mellitus. And then I'm going to kind of let you read through the other slides here. These are other organs that produce hormones in the body. And the ones that I'm going to focus on that I want you to know are the heart, which produces atrial natriuretic peptide. This will decrease blood sodium concentration and therefore blood pressure and blood volume. These are other organs that secrete hormones. The last one I want you to focus on is the thymus, which is involved in the immune response. So it will shrink with age, but it can be involved in the normal development of T lymphocytes in the immune response. So I'm going to stop the recording there because I think you have enough to study